talk about the effects of COVID-19 virus to our circulatory system and the things that we should consider to reduce the risk of getting the virus. The recent emergence of the coronavirus disease 19 caused by the severe acute respiratory syndrome coronavirus 2 is now a global health emergency. COVID-19 has changed many of our daily routine in a way no one anticipated. Many of us are at home or to minimize the exposure. So what are some things that we can do to maintain a healthy and active lifestyle? And what are the ways and how to take good care of our circulatory system, especially our heart? Before we'll answer this question, let us first watch this video to know and to have an overview on how coronavirus disease 19 affects our circulatory system.
Good day everyone, I am Jasmine F. Abacoso and a former student of mine asked me to answer some of the questions about the cardiovascular system in connection to the COVID-19. So I have here 3 questions and let's start answering them. The first question was, what are the effects of coronavirus on the cardiovascular system? The most common effects of COVID-19 to people are acute respiratory infections such as pneumonia and influenza that will trigger any cardiovascular diseases. And this is usually associated with comorbidities. Now, according to my search, there is this acute coronary syndrome and cardiac infarction happened to occur after SARS. It was said that it could induce new cardiac pathologies and would worsen those with cardiovascular diseases. And there is a chance also of heart attack or heart failure wherein the heart doesn't pump blood anymore. For second question, what are some considerations around older adults with cardiovascular disease in COVID-19? Because of the COVID-19 pandemic, older people are afraid to go to the clinic, to the hospitals, to have their checkup, monthly checkup or so. So because they are vulnerable to get infected by the virus, but actually this is not the right thing to do. And what they should be doing is to seek medical care, a book appointment. Actually, now I think at least 2 months because of the strict protocol of having social distancing in the hospital. So there are only few people can get in at the hospitals. Even if that happens, they should still have their checkup so that their doctors can monitor their health, tell them to have proper exercise, track their nutrition, get dehydrated for them to avoid the virus. For the third question, how should patients with cardiovascular conditions manage workplace exposure to COVID-19? In this case, doctors need to counsel their patients with pre-existing cardiovascular conditions to take extra precautions, especially they are in a workplace with, have said here, exposure to COVID-19. But with people with, working in healthcare facilities, I think with people having cardiovascular conditions, they are not going to work and prefer to just work at home. I think that's at least to make them safe. I think that's all. I hope you have learned something from the answers that I gave. So as usual, stay healthy and happy.
Hi, good day everyone. I am Sir Elvin and today we will talk about some information about COVID-19, particularly on the effects of COVID-19 to the cardiovascular system. First, we will talk about COVID-19. So, this virus comes from the family of coronaviruses which could cause cough and cold. And the epicenter of this pandemic was in Wuhan, China. And the source or possible originate where this virus originates, some says there is no exact. Some says this came from the market of Wuhan. Some says it was a genetically engineered virus in a laboratory, in a specific laboratory in China. Or some says that we can get this virus through eating or consuming exotic food like eating bats. So how can this COVID-19 affect your cardiovascular system? We all know that this COVID-19 belongs to the family of coronavirus that could affect or target the respiratory system of an organism. This coronavirus could also affect animals, but in our case, we will focus on human because this would be our primary concern. So how could this COVID-19 affect? So we all know that the respiratory system is responsible in bringing the oxygen through the body, and this oxygen is important for the proper functioning of the human body. And how can this insufficient oxygen affect cardiovascular system? Insufficient oxygen could trigger, number one, you will be infected with corona or COVID-19, and this could cause, number one, myocardial demand. Myocardial demand meaning the oxygen level required by the heart to function optimally. So when there is insufficient oxygen in the heart, this could cause myocardial injury, and this could damage your heart, and this could affect the functioning of the cardiovascular system. Second, we have your inflammation. Inflammation, we all know that this inflammation is caused by infection. This could be bacteria, this could be virus, but in our case, this is virus caused by COVID-19, and this inflammation could clog the pathway, and this could cause injury, and this could damage or this could affect the functioning of the cardiovascular system. The COVID-19 affects your cardiovascular system, and for the group of people, older group of people or older adults, particularly with CVD or cardiovascular disease, they are vulnerable for this type of viral infection. And what are the preparations to protect themselves? By following strict health protocols whenever they go out or from their house, or they will go to their workplace, to their school, or whatever, whenever. They should follow strict health protocols. Number one, by wearing face masks, shields, and by sanitation using alcohol. And last, they could also seek advice from the medical doctors for the type of vaccination that they could avail on, because this could have a negative effect on their body. So in their workplace, this group of people with CVD or cardiovascular disease, we all know that they are vulnerable with this type of viral infection. They could keep themselves protected by following health protocols, strictly following health protocol. Number one, through hand washing, wearing masks, wearing shields, and sanitation. The information that we had today is not only useful for people with CVD or cardiovascular disease, but also to you who are watching this video. Goodbye and have a good day.
The circulatory system, also known as the cardiovascular system, is a vast network of organs and blood vessels that acts both as a delivery and waste removal system for the body. Not only does the circulatory system keep our cells healthy, but it also keeps us alive. The heart constantly receives signal from the rest of the body that direct how hard it needs to pump to properly supply the body with what it needs. One reason people with heart disease may be at higher risk of COVID-19 is because of a weaker immune system, which makes it harder to fight off infections. Another worry for doctors is that COVID-19 can damage the cardiovascular system, a serious issue for people already managing high blood pressure, heart disease, and heart failure. Some individuals who get COVID-19 develop heart conditions after infection too. The good news is there are plenty of things that you can do to stay healthy and safe during this global pandemic. A healthy diet, regular exercise, and managing stress are just a few ways to manage heart disease and high blood pressure. The American Heart Association offers some advice to help you at home, including follow your doctor's advice, including taking prescription medicines as directed. Limit alcohol and caffeine. Talk to your doctor about prescription medicines that can raise blood pressure. Monitor your blood pressure with an at-home blood pressure cuff. Get creative to stay active. Make healthy eating a priority at home by cooking with clean ingredients. And of course, make sure you are taking steps to reduce your risk of getting COVID-19, including washing your hands, wearing a mask, and following social distancing guidelines. No one can deny just how vital our circulatory system is. That's why in this time of pandemic, we must also invest in our health and safety. Our healthcare workers and frontliners are doing everything they can to keep us safe. That's why we must also do the same. Keep safe and be healthy. A friendly reminder from the Cymatic Club. I am Cecil Silvico and thank you for watching this video. Until next time, bye!